Good morning, everyone. It is so great to be with you today. I am Claudia Carravetta, Vice President of Corporate Responsibility and Global Philanthropy at AbbVie and President of the AbbVie Foundation. I'm so pleased to be joined by Stephen Collens, the CEO of Matter, a healthcare startup incubator just based here in the Chicago area and a longtime partner of AbbVie. Stephen, it's so great to share the stage with you today.
It's great to be here, and thanks for this opportunity, and thanks for allowing me to be on the stage with a Twinkie and with bowls, and it's a unique opportunity.
I agree. Well, Stephen and I are excited to be here today to talk to you about health equity, talk to you about an initiative that we're launching as the AbbVie Foundation and as Matter to advance health equity to support communities across the United States. But before we jump into that, I just want to, for those of you who are not familiar with AbbVie, AbbVie is a global biopharmaceutical company based here in the Chicago area. We're a purpose-driven organization. We work to develop and deliver innovative medicines and solutions to make a real difference in people's lives around the world. And with that, essentially, over the last 10 years ago, AbbVie, just a little over 10 years ago, AbbVie was founded. We started the AbbVie Foundation, a 501c3 nonprofit that is really working to be a catalyst for transformative change in communities around the world so that everyone can live their healthiest life. Over the last 10 years, we've really kind of want to build on our impact that we've had within communities. And as the AbbVie Foundation, we continue to evolve and strengthen our mission and further our commitment to advancing health equity through impactful innovation. And of course, as a pharmaceutical company, innovation is the core of what we do and who we are. And I know innovation is really the key driver behind Matter's approach to launching so many successful healthcare startups. And that's really why we're so excited to be here with you today at the Social Innovation Summit to talk about some innovative work that we're going to be doing together and collaborating on to support community-led innovative solutions to addressing some of the largest inequities that we see that are preventing far too many people from achieving their full health and well-being. So before we jump into it, maybe, Stephen, you can share a little bit about Matter and its mission.
Absolutely, and I worked at Abbott for about 10 years. It was my entree into healthcare, and one of the things that I always appreciated about that and still appreciate is that if you ask people like what is most important to them, they will often come back to health. And so at a company like Abbott and AbbVie, I got to work on something that was really meaningful to people. After I left there, I went to an investment firm and then had the opportunity to start Matter, which combined what I knew about healthcare with the opportunity to work with entrepreneurs who are inherently sort of optimistic. They are trying to change the world. They see a vision for something in the world that can be made better, and they have the drive to go and do that. And specifically to do that, focus around health is what we do at Matter. Our mission is to accelerate the pace of change of healthcare, and we work with entrepreneurs all over the world to help them achieve their vision and to improve health and the business of healthcare. And one of the things that we get to do a lot of and really get to spend a lot of time working on and thinking about is health equity, because ultimately none of it, in our view at least, really matters if we're leaving huge swaths of the population behind. So, and I know the AbbVie Foundation is also anchored in a vision around health equity, and that's partly why this is such a good partnership, and would love to hear more about that from your perspective.
Absolutely. So Stephen, as you know, as an AbbVie Foundation, we've been around for 10 plus years. Over the last 10 years, health equity has always been a through line in the work that we've done, working with partners within communities around the world, always in service of how do we close some of the most critical gaps that we see within our society when it comes to health inequities. But I would say, and probably for a lot of the folks within this room, over the last 4 years, there are several events, of course, that have been critical in really putting a spotlight on how pervasive health inequities are, especially within the United States, obviously globally, but particularly in the US. Of course, 2020, the start of COVID, the death of George Floyd, the national kind of reckoning around racial injustice, all of which really prompted more of attention and a spotlight on health inequities, which have existed since the beginning of time, but with a real focus on how critical the gaps are when it comes to these health inequities and thinking about particularly historically marginalized communities when it comes to where these gaps are. And so what we saw during that time is just a real highlighting of where these gaps. I would tell you a fact that really sticks with me that I learned just a few years ago is that in Chicago itself, the life expectancy gap between downtown Chicago and certain neighborhoods of the south side of Chicago is 30 years. 30 years. I mean, think about that. Right here in one of the most cosmopolitan places in the United States. The factors that are driving those gaps and perpetuating those inequities are things that you and I may take for granted. Things like access to healthcare services, transportation, access to fresh food, food security, healthy environment, safe environment, access to educational services. These social determinants of health, these non-clinical drivers of health, are absolutely perpetuating these inequities if not tackled in the right way. So that really came through, I think, when we think about the last 4 years. A second thing that was really highlighted, though, starting with the events of 2020, but in terms of the dialogue since then, especially with community-based organizations and nonprofits, is that there is so much innovation happening at the community level. I think the urgency, the needs that surrounded the pandemic created and spurred innovation and resourcefulness and ingenuity that we're seeing come out right from the community-based organizations in our backyard here in Chicago and across the United States. I think about community health, a partner that we've been working with for years here in Chicago, one of the biggest free clinics in the United States, which is based in the west side of Chicago. It was during COVID that they tested and put into place microsite clinics, essentially embedding certain high quality, culturally relevant primary care services that were embedded in non-traditional locations like a social service agency, et cetera, helping people in those communities get access where they may not have been able to before and helping meet the communities where they are. We have since been working with community health to scale that model in order to bring the microsite model to different locations, provide an array of services, and really help contribute to accelerating the closure of gaps. It is those innovative ideas that come out of community organizations because they are closer to where the needs are and they know what could work for their communities. And as the AbbVie Foundation, we want to be a catalyst to drive transformative change by supporting those innovative solutions in communities, because that's really the only way we can have a sustained impact on this topic. So Stephen, I know Matter is also deeply committed to health equity. Can you talk a little bit more about what that looks like and how that comes to life?
Yeah, for sure. So I love Community Health, by the way. We've done some work with them. It's such a neat organization to be involved with. So at Matter, there's kind of two fundamental things that we do. We opened almost 10 years ago, not too distant from, dissimilar from when AbbVie opened. We run an incubator for healthcare startups, which means that we work with entrepreneurs at different stages. Some of them just have a PowerPoint and an idea. And we have supported 1,000 entrepreneurs who are building companies in every aspect of health and healthcare. We also run accelerators, which are cohort-based. They're 3-month programs where we take 5 to 10 companies at a time on a particular topic, and we really work closely with them and intensively with them on helping them better achieve their missions. And throughout all of that and all the accelerators we run, the incubator that we do, we try to infuse equity, issues around access into all of it. Because again, as the point I was making earlier, if all we're doing is supporting entrepreneurs who are helping people of means who don't have to deal with the challenges of any of the sorts that you discussed, that doesn't feel right to us in advancing our mission to accelerate the pace of change of healthcare. So an example of that, we recently wrapped up a couple weeks ago an accelerator focused on maternal health, and specifically working with entrepreneurs whose solutions have the potential to reduce maternal mortality in the United States. You know, you talk about the gap in Chicago and other big cities, unfortunately, the lifespan gap. Well, the United States is also the most dangerous country in the developed world in which to give birth, in which to be either pregnant or give birth or be a new mom. And that just that doesn't. I mean, it's embarrassing. It shouldn't be that way. So we ran an accelerator. We had the opportunity to work with HCSC, with some large life sciences companies, with 3 health systems, including University of Chicago Medicine, based here, and work with 10 entrepreneurs, 10 startups whose solutions really have the potential to make a dent in that problem. And that's the kind of work that we love to do. And to be able to then take that capability that we have and apply it to the program that we're going to be running together with you is particularly interesting to us. And so speaking of that, share a little bit more about how it is that you're thinking about the foundation and applying it to work with us to address health equity in really a novel way for the foundation.
Well, we're really excited, Stephen, and to announce here that in September, we're going to be launching the AbbVie Foundation Health Equity Accelerator. We're super excited about it, and when we kind of conceptualized this idea last year, we were thinking about, at the AbbVie Foundation, the kind of partner we really want to work with, a partner that's committed to health equity, that is really grounded and has a deep-seated commitment to innovation, and of course has been very successful in supporting organizations from taking innovative solutions to impact. And that's why the AbbVie Foundation is partnering with Matter on this initiative. And as Stephen said, the idea is really to take the concept of the accelerator, which is used so often for for-profit startups, investing in early stage kind of innovative solutions, and really supercharging those solutions so that they can be tested and scaled and show impact really quickly. And we want to apply that to community-based organizations and nonprofits that have disruptive, innovative solutions to tackling critical challenges that are contributing to health inequities across communities in the United States, and have those solutions really put to work so that we can start closing these tremendous gaps that we see when it comes to health inequities. We are extremely excited about it. At the end of the day, as we talked about, the innovative solutions have to come from the communities themselves, because ultimately they know the dynamics of their environment the best and what will really work and be successful. These organizations just need a catalyst and a boost in order to be able to supercharge these ideas and put them into practice in an efficient and effective way. We're super excited about this partnership. And so, Stephen, can you talk a little bit about why this accelerator model being applied to health equity is going to be so impactful?
Yeah, I mean, we've run 50 accelerators so far in the history of Matter, and we have not done one that is specifically focused on nonprofits. And we know that there's a lot that we're going to learn about working with community organizations. But the frameworks that we have, we are very confident we'll be able to work with organizations in a different way. And it's part of what's so interesting to us, is we've developed this capability and we get to apply it in a new way, and we get to do that now, where we all feel a sense of urgency around trying to do something around health equity. And there is so much innovation happening. And I'll say, as we sort of get close to wrapping this up, I worked at Abbott for a while. We have worked with AbbVie since we started Matter. We've also worked with a lot of other pharmaceutical companies, and AbbVie does innovation in a really unique and often much more quiet way than other companies, but has been particularly effective. And I think that is translating now to how you're looking at the foundation, in particular with this project.
Yeah, absolutely. I mean, the same kind of commitment and passion for innovation that we apply to our business model and how we operate as AbbVie is really what inspires who we are and what we do as the AbbVie Foundation. And what we want to be able to do is support and embrace the bold thinking and kind of the measured risks that community organizations are taking and supporting those innovative solutions, because ultimately, these are community-based organizations are the ones that are closest to the community. They understand the needs, they understand the opportunities, they understand the potential of the communities that they serve. And what we want to be able to do through the AbbVie Foundation Health Equity Accelerator is to have those community organizations and those ideas seen and heard. We want to support those groups and those organizations through mentoring, through access to resources, through access to network of experts in health equity, through education, through program incubation, all through that time in order to take these innovative solutions into testing, into scaling, hopefully replication, and maybe even adoption from a policy perspective. So these ideas can have sustained impact over time. And that's really what our philosophy is around innovation. That's core to who we are as AbbVie and the AbbVie Foundation. And we are so looking forward to partnering with Matter on this initiative and partnering with a number of different community-based organizations that are so committed to closing these gaps in their communities and helping uplift their communities and the individuals within it so that they can live their healthiest lives. And that's what we're all about.
Yeah, and I know that you also share the view that health equity is a very complicated, very thorny, almost intractable problem. And we approach this with a certain level of humility that we're not going to solve it with this, but we can make a dent and we can harness the capabilities of both of our organizations, and we are really looking forward to that and hope that you will all follow along as we launch this program and work with organizations to make a dent in health equity.
Absolutely. We're excited to share more about the accelerator in the coming months, and we look forward to launching it in September. So thanks so much, Stephen. This has been a great conversation, and thank you all for your time.